at the podium, if anybody has not signed up. Hello. Thank you. Okay. Okay, watch my phone in case they send me messages. Okay, what do we do? Put it on here. Okay, I think we definitely have a quorum now, so it's a Friday afternoon on a beautiful day, so let's call this meeting of the Health and Human Services Committee to convene, and I will call Representative Earhart to present House Bill 416. Oh, and Chairman Meadows, welcome to Health and Human Services.
Thank you, Madam Chairman. I'm going to defer to Chairman Meadows first, and I'll, if that's all right with you.
Again, Madam Chair, members of the committee, appreciate you meeting on Friday afternoon. We've been through this once before. We made changes in the bill that hopefully, I know it's not going to satisfy everybody's want list, but we did make changes. And we think we've been led to believe that those are positive changes for those who are opposed. I've got just one thing to say. Well, I might say more than that. But we're sitting out here doing something that people are trained to do. They haven't gotten to do their job because it's not been allowed, so they haven't done it in years. If one of these optometrists wants to do this, they've got to go back to school. They've got to get continuing education so that they can pursue this line of practice. And with that said, things that I don't understand, we let dermatologists shoot around the eye. And I know that's around the eye, and under that piece of cellophane is still in there. We let PAs shoot around the eye. And even better, we let tattoo artists tattoo your eyeliner on the bottom, and they're not under anybody's direction. I hope that they don't stick something in your eye when you're trying to get the black mascara look on there permanently. But I want you to please take a look at the bill and the amendment that's been put in there. And we think, again, I'm not going to ever satisfy everybody. But I think that we've done most of what we've been asked to do. With that, Mr. Earhart, please.
Wait a minute, Mr. Chairman, I didn't get to give you a hard time when you went to the well and rules the other day, so I'll just give you a hard time now.
Remember how nice I was this morning in
I know,
rules.
sir. I'm just pulling your leg. If you could put a bill in to take away the tattoo or whoever puts those eyeliners in, I'll be glad to sign it with you and help you move it through. So that's it. Smile. I'm just trying to give you a hard time. You're just so anyway. Okay, Representative Earhart.
Thank you, Madam Chairman. Let me explain the changes to House Bill 416, the changes that were to House Bill 36. The first change is we return the language whereas the Board of Optometry establishes a formulary for the pharmaceutical agents for the treatment purposes. That was one of the things that was brought up. Number 2, added the peribublar intraorbital nerve block to the prohibited injections. Number 3, it removed the oversight and credentialing from the U.S. Department of Education and Council of Post-Secondary Ed and provided responsibility to the Board of Optometry. Number 4, and this is very important because we heard some things about the length of the course, mandated for all optometrists doing these injections to complete a 30-hour course approved by the board. And number 5, clarified and added that the hydrocodone can only be administered orally. Those are the 5 changes to the bill you'd had in front of you previously in this new bill, House Bill 416. And since it is Friday, I'm not going to spend a lot of time. Look like a lot of people were signing up. I do want to reiterate what Chairman Meadows said about, we heard the testimony, we heard the concerns, but again, 15 states, 20 years of experience, no malpractice claims. same injections. That's a significant amount of history. Now, I am going to mention the bloody eyeball that the ophthalmologist put up on the screen. So I'm not going to bring a bunch of pictures of malpractice suits in those same 15 states from ophthalmologists, but I could. I wouldn't want to get into that purient interest with the members of the committee. It's a little bit difficult to take on a Friday. So if they go down that road again, then maybe we can come back and show pictures as well. And just one final thing, if our friends from the Composite Medical Board come back again and stick their oar in this water, I'm going to admonish them that maybe they need to spend a little bit more time worrying about the sexual offenders who they allow to continue to practice medicine in this state, the doctors who have traded money for sex that continue to practice, rather than worrying about professionals who are highly trained in their profession. So I hope they come back, but they and I are going to have that conversation.
Representative Earhart, with all due respect, just as your side has worked and gone forth in lobbying for your side of the bill, is it not true down here in the legislature that we allow all sides to lobby? They're not always right. I will tell you, I think you maybe have gotten some misinformation. There are only 8 states that by law allow for the injections in the eye. I checked the figures, and I'm sure you've just gotten, and you would never tell us anything that was wrong. There are the other 7 that are silent on it. So there are 42 states that do not by law allow this. But I think both sides have the right to lobby that without retaliation against either side, the medical board or anyone else. I mean, I have not gone after the optometry board. Don't intend to.
What retaliation, Madam
but-
Chairman?
Well, saying that, you would, go after them and that kind of stuff.
I'm lobbying for my bill, Madam Chairman, with all due respect.
Well, okay, we can just keep
We
it
can
to the
agree to
bill.
disagree.
Okay, Representative Broadwick, questions for the chair, the author?
Thank you, Madam Chair. Chairman Earhart, I've got a question on lines 23 through 25. Are we granting optometrists controlled substance prescriptive authority with this act?
No, sir, that is where we're making it clear that the hydrocodone, I believe, is only administered orally. That's current law. We're not changing the law with respect to that in any way, shape, or form.
Thank you.
Okay. Representative Price.
On lines 29 through 33, is the intent to open that up to all medications?
I'm sorry, I didn't hear your
Well,
question.
would the author object to an exclusion for local anesthetics?
I believe there's an amendment coming with respect to certain anesthetics and blocks, so I'm not going to have any objection to that.
Okay.
I'm sorry, do we have that today?
Is that I think there's an amendment coming to that, on that specific point, is there not?
No, I haven't seen an amendment. Do you have copies for all the people? Yes, Madam Chair, I do. Thank you. Okay, Representative Lott?
That was my question. I was going to ask about the amendment.
Okay.
Thank you.
Thank you. Representative Parsons?
Thank you, Chairman. Chairman Earhart, I wanted to ask you on line, I guess it's lines 12 through 13. I guess that's actually where we're talking about what they'll be allowed to do that they can't do now. I was at the last hearing, but I don't recall what these different things are. The subtenon, it still would allow them to do something with the eyelid. Is that correct?
That's correct. It's in and around the eye. Those are different areas of the eye.
But
Yes,
are these associated with the eyelid? I mean, I'm not even sure. Are these associated with the part that we're trying to get them to, the
All
authority
parts
to
of the
do?
eye. Yeah, that's underneath. That's in all those areas of the eye. Yes, sir.
Well, then what would they be able to do? I mean, I really don't understand what they could do after
Administer an
this.
injection
In the eyelid, is that correct or not?
in the subtenon, in the retrobulbar, in the parabulbar, in the intraorbital nerve block, the intraocular, and botulinum toxin ingestion. If she or she, they'll be able to do all of those things. Not to do all those things. Not do all those things. I'm sorry.
Okay. All right.
with the exception of those things.
I mean, I'm just not, I appreciate, I'm just
Except.
not familiar with enough of those terms to know what but thank you, appreciate it.
Except those areas.
But Representative Earhart, they will still be able to do subconjunctival, vial injections. That's one of the little layers.
Mm-hmm.
That one would still allow that?
Yes.
Okay, and that's one of the little ones that are in between and are a hair's breadth apart?
That's correct,
Okay,
which they're trained to do and have done in those other states.
okay. All right. Price.
I'm sorry?
Thank you, Madam Chairman. On lines 12 and 13, and I'm not sure if we're dealing with an amendment yet, but those are all locations or types of blocks. Is that correct?
They're all locations, yes.
Okay, could you,
I'm not going to get into a medical discussion, Representative Price, with that. It's self-explanatory with respect to where they are if you're a medical professional. I mean,
no, well, I just
I
wanted to.
can't give you the, I'll submit right now that I cannot, in a didactic terminology, give you the entire history of retrobulbar.
Representative Price?
Nor was I going to ask that. Would you let me ask my question? Or do I still have the floor?
Yes, but if it's a technical question, I think you would be better to, about
No,
the eye to a physician rather than the author of the bill to tell us.
That's
I
correct.
just wanted to clarify, if lines 12 and 13 are referencing locations or types of blocks, and on the reverse page, we're talking about pharmacological agents, I just was curious, where do we find the botulinum toxin area of the eye?
Is
Was
your
that a question?
Yes?
You said you were curious. I didn't know if you wanted me to,
I'm asking
Well-
you, yes.
which part of the eye did you ask me to specifically expound upon? The what part? Where
I
do-
ge-
You said,
I-
where do we find, and I did not hear the word.
Yeah, the botulinum toxin location. If we're going to distinguish lines 12 and 13 from lines 29 through 33.
Botulinum toxins are the accepted language in 12 and 13. In 29 through 33, other pharmaceutical agents related to the diagnosis or treatment of diseases or conditions of the eye. Makes sense to me.
Are you finished?
I asked my question, thank you, yes.
Okay, Representative Lott.
I appreciate, I know you've worked pretty diligently on making changes to this. And even today, I went back to the original to find out where some of those changes were. And then I appreciate this amendment as well. So even to some of what Representative Price was stating, I also think it's somewhat clear that there's an exception list. I appreciate that you've added some additional things to this. On the amendment list, the facial nerve block, subconjunctival anesthetic, dermal fillers, intravenous injections, and intramuscular injections. So I just saw that line as an exception line, correct? So I know that even though not all of those that are listed are like intramuscular injections, those are not body parts, but it is true that that is your exception list, correct?
That's correct.
Thank you.
Other questions from the committee? Okay. I have a question, Representative Earhart. Even though there may be some people that feel like the amendment, if it passed, would still make the bill not acceptable, that what I would like to ask, should it pass, are we having your commitment that I know there's a bill on the other side, that if it went to a conference committee that you would hold to these?
My commitment is we would hold these. You're talking about the amendment, the facial nerve block, the subconjunctival anesthetic, those kind of things. Yes, I will
Give us your word. Thank you.
do everything I can to attempt to hold those,
Okay. And like I say, there
depending
may-
on if I'm on the conference committee. And
Right, yeah. But I know that you do have a lot of sway and probably Chairman Meadows would also be on that conference committee, and that holds a lot of sway with what gets done. Although, like I said, just because we amend something doesn't mean that people may think it's good enough to pass one way or the other. Okay, Representative Price?
Yes, could you just clarify, are we dealing with the amendment as well, or not?
Not yet. We have people that want to,
Okay.
are you going to ask a question about it?
Well,
but
I
while
wonder why we're specifying subconjunctival anesthetic as opposed to anesthetic in general, because with that only, that's only one very, very small part of the eye, so that it would lead one to believe that you're planning to use local anesthetics elsewhere in the eye, which doesn't really fall under the description of diagnosis and treatment, because a local anesthetic would be used for surgical procedures such as upper and lower blepharoplasties. Is that the intent of the optometrist to perform those within the next 5 years?
Certainly not. No, it's not the intent.
Okay. Representative Price, if you wanted to offer an amendment to the amendment at the proper time, and that's certainly your right as a member of the committee. All right. Any other questions from committee members? All right, we don't have any. Let me call on people. Brian Kim.
Are we finished, Madam Chair?
Oh, I'm sorry. I mean, I'm sorry. It's really, I'm just trying to move along.
Okay.
Do either of you, Mr. Chairman, or have anything you want to add to the
No.
Representative Everhart?
Thank you, Madam Chairman, members of the committee. I ask your
Okay,
favorable
and-
consideration when it comes to.
I'm sure, are you staying or is somebody staying in case there's other questions?
I'll stay.
Okay, thank you.
Thank you.
Okay. Brian Kim? No, it's Dr. Kim. Please identify yourself and,
Hi there again. My name is Brian Kim, and I am Madam Chair and esteemed committee members. Thank you for having me again. My name is Brian Kim, and sorry that you have to do this Friday afternoon. It's a gorgeous day outside. And I'm an ophthalmologist. I've been practicing for 10 years in Dalton, Georgia. I'm also the president of the Georgia Society of Ophthalmology. As you know, this committee has heard this bill in the form of House Bill 36 in the past, which was voted down. And contrary to what you may hear, the bill is essentially the same. The main difference is the 30-hour of training stipulation for certification. And this bill still includes allowing optometrists to inject around the eye and the eyelid with a needle. So as far as safety is concerned, remember, we want to provide the best for patients, and that includes safety. And we don't want to harm patients. Eyelid injections have risks, even though they might sound benign. You can inject too far and puncture the eyeball. You can inject steroids, which is this anti-inflammatory medicine, and it's tiny crystals inside it, and when you inject it, it can actually travel into the blood vessels and cause blindness. These are real complications by highly trained dermatologists, ophthalmologists, plastic surgeons, and even they can have these complications. And so when they're this trained, and then you're taking someone who has less training, you do the math, they're going to have these types of complications as well. Regarding the conjunctiva, as you've heard, the conjunctiva is that thin layer, it's kind of jelly layer that covers over the eye like a blanket. The white of the eye is like the tread on a rubber tire, and it provides structure to the eye. This is the thickness of the white of the eye. It's a dime, 1 millimeter. So the difference between injecting correctly and causing a complication which can cause blindness is the width of a dime. And we're wanting them to perform these procedures with a 30-hour course. And so remember, yes, I agree, as been said, complications do occur even with medical doctors. But the other component you have to think about is we are all flawed human bodies, and we have human structures that can have complications and issues. And even though you do your best, you can have a bad reaction to the injection. That includes if you take a medication like Tylenol, you can have a severe drug reaction. And so these things can occur. The key is this person qualified to do this? And I want to be very clear. Optometrists do not inject patients in school. They don't inject patients. I'm talking about real patients. They don't inject patients. Ophthalmologists, we inject many patients while we're in training. A 30-hour weekend course is not sufficient. And what they're doing in these courses, they're not inviting patients to have injections. They're saying, hey, you want to get certified? Yeah, me too. Oh, let's inject each other with saline and we'll get our certification. Saline is salt water. If you inject it and you can't do wrong with saline. It doesn't cause harm. But they're wanting in this bill injecting very powerful and dangerous steroid medication and other potential medications which can be very harmful. They are not injecting those medications in this 30-hour course. And the other thing is I work with 3 great optometrists. We're actually hiring another one. They are fantastic. We work side by side. They have no desire to do this. And so I would love the Georgia Optometric Association to poll their constituencies, because they should be reflecting the voice of all optometrists. And I have a suspicion that most optometrists don't really want to do this. You know, the bottom line is, you know, when you're going to hear a lot of things, but bottom line is, and this is the correct needle. This is actually a 30 gauge, so you can see it. This is the actual needle they would be using on a patient. And if a patient doesn't know the difference between an optometrist and an ophthalmologist, and they're going to have an injection on their eye, whether it's you or your family member, would you be comfortable with someone injecting this after 30 hours of training on a classmate injecting saline and not on real patients? Thank you for your attention.
Questions for Dr. Kim? Representative Drenner.
Dr. Kim, thank you for being here today. Just one quick question. Can you explain to me the process of being on call? When you're and an optometrist, does an optometrist fill in for you if they're on call with you?
Yes, our optometrists cover call for us, but I always am on a backup call. So I'm always on backup for them.
So when they're covering for you, do they do the same things that you do?
No, ma'am. Well, they cover my patients if they have a clinical question or a concern. If a patient says, I have a red eye, they will be able to manage and treat those patients, and they do a great job. But when it comes to procedures, they will call me, and I will take care of those patients.
Okay, thank you.
Thank you.
Okay. Representative Lott.
You were stating that they do these saline injections on each other, but that the saline can cause no harm. It somewhat contradicts what you started with, which was it was the injection that was harmful. So is it that the injection is not harmful, but it is the medication that is harmful?
Well, there's 2 issues. If you inject it correctly, then it will cause no harm. But if you inject it and keep going and then you actually puncture the eyeball itself, then clearly there's harm. So those are 2 issues. It's an issue of technique and causing harm versus the medication itself causing harm. And obviously saline, you know, it's not harmful. Most of our body is made of saline. So that's what I meant. Apologize for the miscommunication.
No, I don't think so. I have a question about the PAs. Do you have a PA?
No, ma'am, we don't have PAs.
Well, you're president of the society, right?
Yes, ma'am.
Do the PAs, have any of them that you know, do injections in the eyelid?
No. The only PAs I have encountered are in the ER, and they're hand in hand working with the ER physicians, and they always have called us whenever the patient needed some type of injection.
Okay, thank you for that clarification, because I really didn't know. And that would be the same, of course, with nurse practitioners are all.
Right.
Representative Henson.
Thank you. And you made a comment that most optometrists would not be comfortable doing this. Therefore, they're not going to get the training in order to do it. So you're really dealing not with all ophthalmologists, or even a majority of the ophthalmologists. You're probably dealing with a small percentage of I don't mean ophthalmologists, optometrists. Isn't this very similar to, for you, in your profession as an ophthalmologist? very similar to cataract surgery and the advances that have been made from the basic lens to what you can now get with the laser and with toric lenses and all of that, that you still have ophthalmologists who are only dealing with the basic lens as opposed to dealing with the more advanced lenses.
So
I mean,
what's
to
the
me,
question? I
it's
don't
a type
understand
of
the
thing that
question.
it's the training. I also feel that most, and I cannot say all because of we do read the newspaper, physicians, be they ophthalmologists or optometrists, are very concerned about protecting their patients and also looking out that they don't do anything that endangers their license. So I really feel that, you know, we don't have statistics of this being a problem elsewhere. We seem to be highly concerned about the what-ifs, and you know, after being on Health and Human Services for over 20 years, I've listened to a lot of this, and I've seen a lot of advances. And there have been advances in medicine over the years, you know, a great deal of technological advances that we
Can you
have.
get to the question?
And I guess my question is there really a major problem if somebody is going to take the training, be very, very diligent, and all, you know, the human factor error can happen to anyone, be it an MD, an OD, or
Representative
whatever.
Henson.
So why are we so concerned with giving the optometrists the opportunity to train and to do this?
Well, basically because in my oath, I do the very best I can to protect patients, not just to treat patients. And I know that even in my hands, which I feel like I'm very good, things happen. And if I take someone who has much less training than I have, it's just common sense that they're going to have more problems. And I just don't think patients deserve that.
Just
Thank
a
you.
slight follow-up,
Representative
please.
Henson, no. I'm going to move on. Thank you, Dr. Kim.
Thank you.
Okay, Steve Walsh.
Yes,
If you'd
thank you, Madam Chair.
Identify yourself and
I will, yes. My name is Steve Walsh. I'm a anesthesiologist in Roswell, Georgia, and I'm also current president of the Medical Association of Georgia. And Madam Chair and Committee, thank you for the time to speak. And I hope to provide some information toward Representative Henson's question too. I oppose House Bill 416. I believe that 416, although well-intended, could place thousands of Georgians at risk of blindness and other eye complications. House Bill 416, as I understand it, is really a proposal to increase the scope of practice. And increasing the scope of one's clinical practice is really grounded in supervised clinical patient experience and training. And this is what we call a fellowship, an extra year of training and experience. Scope should not be gained solely through a legislative experience. We often hear scope issues that come from physician's assistants and nurse practitioners. But I would say this bill is even different from that. With respect to PAs and nurse practitioners, their scope request, they would continue to work with the supervision of a physician. In this bill, though, the optometrists, they have independent practice. So what this bill is adding scope, a broader scope to what they do. So I see this as very different. But I applaud the optometrists for the role they play in our eye care, you know, trained to detect serious eye health issues, fitting us for glasses, contact lenses, and vision devices. But sticking a hypodermic needle in and around somebody's eye is different. It requires a different skill set, and I believe far more education and training experience. I'm an anesthesiologist. I perform injections daily with hypodermic needles, and these procedures will place a needle tip within millimeters of a patient's spinal cord or a great artery or vein or major organ. But I will say, even with my skill set and training, I do not place injections around the eye.
Dr. Walsh, if you could just, I hate to shorten you, but I'm afraid I'm going to lose people.
Okay.
It's Friday afternoon, and so I'm going to start
Okay.
cutting and everybody down to a little bit of time.
And thank you. I'll make my comments brief. So with that, I believe that with injections, there is a risk of hemorrhage. And hemorrhage in and around the eye is serious, can cause blindness. That risk of hemorrhage is even greater than it has ever been. And that's because we have more patients on blood thinners than we've ever had before. Aspirin, NSAID, Xarelto, Pradaxa, the list goes on. And really, in this instance, we really need to know when and if it's appropriate to even do an injection. And so it's for these reasons that I believe that House Bill 416 is not a good idea. It will put patient safety at risk, and I urge you to oppose it. Thank you.
Thank you, Dr. Walsh. I'm one of those patients. I got a small watermelon on the day 7 after having knee surgery from the blood thinner. I had a small watermelon in my knee. Thank you very much. All right, Aubrey Villiles.
Thank you, Madam Chair, members of the committee. We have polled our members, and they support this legislation. In fact, I've got a letter here from a medical doctor, and we've got others. Maybe they need to poll their members. What I'd like to do is address the amendment, if I could, primarily. You have in front of you amending it regarding facial nerve blocks, subconjugal anesthetic, dermal fillers, etc. I got this mostly from the society's letter. I just took off that. They had some objections, so I tried to address most of them. I think I addressed all but 2 of them. In reference to Dr. Price's suggestion, if she wishes to strike subconjugal and just make it anesthetic, we'd have no objection to that. If you want to do that, you could just do that, and that way it's clear. Our intent is not otherwise, but that would address that problem completely. One of the things they keep saying is this is just a 30-hour course. It's just a 30-hour course. That's not correct. It's 4 years. And most of these optometrists have had it during that 4 years of studying nothing but the eye. Not the arm, not the leg, not the foot, but nothing but the eye. And the reason we put the requirement of having an additional course on these people who have already been taught it in school is there are some who didn't have it in school. We want to make sure that everybody has to take it over again, whether they had it for 4 years or whether they only had it for the first time, but they had 4 years of the eye. So it's not like, well, they're just getting 30 hours and that's all. No, it's just 30 hours of looking at that injection. 30 hours of just looking at that injection. That's all it is. I want to make that real clear. A couple of other points and then I'll sit down. Madam Chair is right. There are 8 states that explicitly state that you can do injections. There are 7 that are silent, and the law allows them to do it, and it does occur in those states. But you're right, only 8 states explicitly say you can do it, and that's where the 15 came from. You know, we're all about safety, but you won't have any horror stories about us injuring the eye, even though it's been done in those other states. You're not going to bring it. I'm not going to bring any against them either. I will make one comment. If that eye was bleeding the other day, it wasn't one of us because we can't do that procedure. We've heard this same argument. When we tried to do drops, we said it's going to have heart problems, beta blockers, going to interfere with it. When we try to do antibiotics, which we can do, they said, no, you're going to all overprescribe antibiotics. There's too much of that now. That hadn't occurred either. And then when we got narcotics, limited, they said, addiction's a problem. You're going to overprescribe. That hasn't occurred either. And all these horror stories they're telling you now, they're not going to occur. We have a standard of care, and we're going to abide by it. And we put all those other things in there because they raised those objections, and we wanted to make sure that if those are true objections, we're going to cover it, because even though we thought it didn't go that far, we wanted to clarify. And thank you very much. We ask for your support of the legislation. And I'll answer any questions. Yes, ma'am.
Well, just the one question like that, you know, that gives the board stuff, but the board of Optometry has yet to make rules regarding the proper use of hydrocodone. So, I mean, there is a lag in that. Just
And I
make it-
would agree with you. And I
You'd
brought,
like
the
that for
moment you
them to
said that the other day, I
actually
brought
make
that to their
the
attention.
rules, and, you know, you're saying here that they will oversee this and make the rules. Well, we've had that ability for about 2 or 3 years, and the Board of Optometry has not made rules yet on the proper administration of hydrocodone.
I agree. And even though we've had no problem with that, we
There's
should make the
no-
rules.
I mean,
Yes, ma'am, I agree with
Audrey, I
you.
don't believe unless you can get into the PDMP, you can actually say there have been no problems because, and if you can get into the PDM, the
Not
feds
gonna-
will be, I mean, the drug narcotics will be on you.
Not going to argue with the
I-
honorable chair. Thank
Okay,
you.
thank
Thank you
you.
very much.
Representative
But I would ask you to
Parsons?
consider passing that amendment on it as well. Thank you.
Representative Parsons, do you have a question?
Please, as many as you want.
I did want to ask you, over the years since I've had to wear glasses, I've gone to both optometrist and ophthalmologist, and I haven't had any problem with either as far as that's concerned. And I still don't understand exactly, you know, why the optometrists want to do this. But how would I even, as a patient, how does somebody even get in a situation where an optometrist would offer to do this? I'm not sure. I mean, if I go to get, I wouldn't just call an optometrist, make an appointment. I need a needle in my eyelid. So I go there to an optometrist. So how does that lead into even happening?
Well, I'm not a real doctor, but I
And
did stay
and
in
why
a
wouldn't I
Holiday Inn
just-
Express once.
Why
I'm
wouldn't
just
I
a
Get to
ju-
play
I'm just
one
a Jewish
as
doctor.
a lobbyist.
Isn't that wouldn't that be a medical issue where you have some kind of, you're not just going to get your glasses, you would have some kind of an issue with your eye that would lead you to calling a medical doctor? I mean, I'm just asking. I don't know.
I'll be happy to. We treat conditions and diseases of the eye. We just don't do glasses and contacts. And what I would envision, someone comes in there and they have a problem with that lid or whatever, maybe it's a sty, you're going to try conservative treatment first. You're going to try everything first. And you may try orals, and again, I'm not a doctor, you may try something topical. And then the last resort, I would assume, would be an injection. But please understand, we just don't do glasses and contacts. We treat diseases and conditions of the eye in our code. That's what it says. And I can't answer really technical questions. I didn't stay in that Holiday Inn long enough, I guess. But, you know, but if that answers your question, we treat diseases and conditions of the eye. We just don't do glasses and contacts.
What? No. Okay,
If I may, I know we need to get out of here, but.
right.
Okay, one more question. I don't know the answer to this question. I probably shouldn't even ask it, but you and I had a conversation about our military service.
Yes, sir.
And there are a lot of things the military, as far as healthcare does, is different than. Do you know how the military, how do they handle this in the military?
I use the VA as my hospital, and I can tell you the VA allows these injections.
I checked that information. The VA nationally does not allow them because it's illegal in many of the 42 states. It would not allow that to happen. And so it is not a national allowed VA policy.
Again, I would not
according to
disagree with
the
the chair. I was
information-
told yesterday they did, but if you know something otherwise.
Right. Okay.
Does it vary from state to state, Madam Chair?
Yes, because
Okay,
it would
thank
be
you.
illegal since it's not really allowed in silent in some of those states, which is pushing it.
So-
Then it's not allowed in those states.
So it would vary from the states that allow it. Okay,
Right.
thank you.
Representative Beverly.
I think we'll have testimony to it's.
Okay, all right. If we can just, because it's getting late, Paul,
Jamian.
I think did you speak last time? And go ahead. Yes. And I have a question, I think, and you can just clarify, I'm not trying to be difficult, but you said you had a 3-year fellowship, and I couldn't find any reference to where there was a fellowship offered for an OD to do a fellowship in this kind of, maybe I misunderstood. But I could not find a
Thank you, Chairman
fellowship.
Cooper. I got called up here last time, as you recall, to answer some questions that others deferred to me, and I didn't get to properly introduce myself and answer that question.
Okay, and if we can just keep it succinct.
I will do my very best, but I appreciate you letting me answer. My name is Paul Ajamian, not Paula Jamian. Some people think I'm a woman. And bottom line is that I did a 3-year fellowship, 2-year fellowship, and then an extra year at Bascom Palmer. I'm not an ophthalmologist. I did not do an ophthalmology residency. This is training post-optometry school.
Okay.
I brought along with me today several residents and who are residency trained or about to be residency trained with me. There are about 350 residencies that's post-grad training after optometry school. I have been a past president of the Georgia Optometric Association and legislative chair, and I've seen these battles. As Aubrey said when I went through my book the other day, blood will be running through the streets was in the AJC when we were trying to get diagnostic drugs. Bottom line is that none of that has happened, that foreign bodies created another controversy, and foreign bodies involve not only the cornea, but metal under the conjunctiva, the thin layer that we're talking about injecting under. We go in on a routine basis, pull that conj up, take those foreign bodies out. We're dealing with the conjunctiva a fair amount and very comfortable with it. You know, you can't compare the training, which is why I brought up Bascom Palmer to you, because a lot of the training during a residency is related to surgery. We don't do surgery. We don't go through that surgical training. The questions that came up regarding things that we're doing now, that why would we want to do them? Why would we want to prescribe an oral narcotic that we battled for? I've only prescribed 2 of those in the last 2 years, but in the middle of the night when someone's in pain, we may need to do it. The same with injections, Representative Parsons. It's the same as any surgeon, directing back to Representative Henson, who can do anything, but only chooses, of course, to do what they're trained to do and what they feel good doing. So the doctor from Emory, who I think will speak, does retinal surgery. He doesn't do cataract surgery because he's not comfortable with it. If we're not comfortable with injections, we won't get certified to do it. And if we don't need to do it, obviously, we're not going to do it. Bottom line is that you will hear or have heard that a lot of optometrists are against this. There are some that won't do it. That doesn't mean they're against it. There are some that work for ophthalmologists
I'm
that
fixing
have...
to lose I don't mean to interrupt, but I ask you to be succinct because I'm fixing to lose my committee. All right? So rather than talking
Just
about...
1 minute to wrap up.
Yes.
Bottom line, thank you. Bottom line is that there are plenty of optometrists who want this ability because they're trained in school. To answer your question about PAs in Utah are injecting needles directly into the eye with Avastin, and we do have evidence, direct evidence, as far as the VA is concerned, that there are optometrists in VA hospitals in states that don't allow this that are doing it. Not a lot, but there are. So I just wanted to set that record straight, and I thank you for your time.
Thank you very much. I'm very sorry they have to share, but I'm just getting messages from the
understand.
committee. I'm going to lose my committee. Dr. Hubbard, you've got 2 minutes. You're the last.
I wish to waive, Madam Chairwoman.
You wish to wait. Okay. We are going to move. Let's hear what we need to get a position on. What is the committee feeling on House Bill 416?
Move to pass.
Okay, I've got to move do pass. I've got a second. Okay, we're going to go to the amendments. I think Representative Price, did you have an amendment to the amendment?
I have a procedural question. Do you take amendments separately from the main motion?
Yes.
So we vote on amendments, then we vote on the main motion with the amendments?
Yes.
Okay. I'd like to make an amendment, please. Is this the time? What?
Pardon?
I'm confused. We have a motion and a second for the main.
For the main bill.
Okay, I'd like to offer an amendment on line 30.
Okay.
After other pharmacological agents,
Right.
comma, with the exception of local anesthetics.
Okay. Is that it?
Well, I'd like to strike all of line 29 and leave it the way it was, but,
Okay, and so this is an amendment by itself, not an amendment to the amendment that's been offered? Okay,
correct, but I have another amendment related to that one.
okay, all right, okay, so we have a proposed amendment from Representative Price on line 30, and it would read, other pharmaceutical agents, comma, with the exception of local anesthesia?
Anesthetics.
Anesthetic. Then continues. Do I have a motion on that? Yeah, motion second. Okay, Jaspers.
I'm waiting for, I'm ahead of myself.
Okay, all right. I'm gonna recognize you, Ms. Hempson, if you can make it a question.
Do they currently do local anesthetics? So we're taking.
Topical.
Topical.
Not
Okay.
injection.
Okay, are we taking away something that they're already doing?
No. Well, with the exception of local anesthetics, would you like to amend to say
With the exception of injected
topical?
local
With
anesthetics.
that. Okay, so it would read, with the exception of local anesthetics.
Correct.
Betsy, how would it read?
How about with the exception of injectable local anesthetics?
Yes.
Okay, that's fine. All right, that okay to the, okay. All right, do I have a second on Representative Price's motion?
Madam Chair, parliamentary inquiry.
Okay,
Thank you so much. I'm just want to make sure we got the posture. We had an amendment on the floor, and I think we just got a second. When the discussion came up, we amended the amendment by adding what
Oh, she
she
changed
added.
Representative Reinders.
Yes, thank you.
She agreed to go back and change it.
Okay, thank you.
All right, so, okay, I have an amendment and a second. Everyone in favor of the amendment, raise your hands. Okay, please. Okay. Okay. All right, just hang on. Okay, so the amendment passes. All right, we had another amendment. Representative Lott, did you want to offer that amendment that was passed out?
On the amendment as written. Do I need to
Okay.
clarify that?
Yes, go ahead.
Shall I read it? Amendment HB 416, page 1, line 12, after the word peribulbar, the following: facial nerve block, subconjunctival anesthetic, dermal filler, intravenous injections, intramuscular injections.
Okay, we got an amendment proposed and second. Betsy, with the other amendment we do we need to change anything on this one? No. No. Okay, just making sure. Okay. Representative Jaspers?
Chairman, I just want to make sure that the previous amendment, we had talked earlier about the subconjunctival anesthetic
Okay.
would not be needed. Is that still
Pardon?
in the previous discussion we had, the second one, subconjunctival anesthetic would not be needed? Is that still, it still
yes.
needs to stay in there?
No, it stays in there, it's what Betsy said. Okay, so everyone in favor of the, Dempsey, Representative Dempsey, quickly, we're
So,
losing people.
I just want to say that this is so very technical, and I
Right.
kept hearing in the discussion, no one can really address the technical in it.
Right.
I don't really feel qualified to vote on that. I'm just going to tell you that I do not. I think
Okay.
that we're moving quickly, and I
Well,
don't feel good
I
about
mean,
it.
like I said, just because the
This is
amendments
very
pass
specific.
just because the amendments pass does not mean then you have to vote for the underlying bill. So, thank you for saying that. Okay, here we go. Everybody, it's in favor of the amendment 416 as passed out. Raise your hand. We're voting on this amendment that Representative Lott made. Yes, I'm losing people, Betty. Betsy said we didn't. I will have to go with, how is she, I'll have to go with the judgment.
We're not using any anesthetics, why would we accept?
It's,
Kind of a big suspenders thing, but
it's just in both places, and it's fine to leave it in both places?
It probably does make sense to delete that word.
Which one? Okay. Representative Lott, are you in agreement to that?
Make a motion that we remove subconjunctival from my prior amendment. It will read facial nerve block, dermal filler, intravenous injections, intramuscular injections.
Okay, we have that. Everyone in the favor of the amendment to 416 that was made by Representative Lott and then amended by her, raise your hand. Everybody in favor? Okay. Anyone opposed? All right, we are now to the bill. Everyone, we have a motion to pass. Everyone in the favor of the passage of House Bill 416 as amended, raise your hand. For passage, okay. You're for it, passage? You're for passing it? No, we take one off. One off. Did you count him? He changed his. Okay. Okay. Everyone against, please raise your hand. Keep it raised so we can count them. And we have two members. Did you get them back in the back? And we have two members back there. Okay. Okay. What is it? Okay. The passage of the bill, House 416, as amended, fails. So, thank you very much. Pardon? Would you please announce the vote? Sure. I'll tell you, it was 13 to 14. Okay. 13 to 14. Thank you to my committee. We are adjourned.